Good morning, students. We'll start with the next topic, that is mental retardation. So what is mental retardation? Mental retardation is also called as it is also called as intellectual disability. Okay, it is also called as intellectual disability. So mental retardation, it is usually a condition. It is usually a condition in which there is below average of general intellectual functioning. Okay, so there will be low level of general intellectual functioning as well as lack of necessary skill. Okay, and as well as lack of necessary skill which is required for independent daily living. Okay, it is required for carrying out our daily living. Okay, so which is required for carrying out our daily living. So that is mental retardation. It is also called as intellectual disability. Okay, mental retardation, it is also called as intellectual disability. So this is usually required, or it is usually defined as the below average of the intellectual functioning and also lack of necessary skill. Okay, lack of necessary skill that is required for carrying out daily activities. Okay, that is required for carrying out daily activities or to live independently. Okay, to live independently. So that is usually about this mental retardation. So what is mental retardation? So mental retardation, it is usually it is also called as intellectual disability. Okay, it is also called as intellectual disability. So in case of this intellectual disability or mental retardation, it is usually defined as or is a condition of the below average of the intellectual functioning and also lack of necessary skills. Okay, lack of necessary skills that is required for carrying out the daily activities. Okay, carrying out the daily activities independently. So that is usually about the definition of the mental retardation. So next is this intellectual disability or mental retardation in the children are limited in two areas. Okay, it is limited in two areas. That usually includes is that intellectual functioning is also known as intellectual quotient. Okay, intellectual functioning is also known as intellectual quotient, which usually refers, or you all know, you would have studied in the psychology. Okay, this intelligent quotient you would have studied in the psychology. So what it does mean? It means that it refers to the child's ability to learn, reason, judge, make decision as well as solve problems. Okay, so intellectual functioning, it is usually known as intelligent quotient. Okay, it is also known as intellectual quotient. Okay, or intelligent quotient. So this is usually includes that it is the ability of the child to make decision, to take judge, to make decision, to make reason, to learn. Okay, to make reason, to learn as well as to solve problems. Okay, as well as to solve problems. So this is usually also known as cognitive development. This will be delayed in the mental retarded child. Okay, that is usually the cognitive development will be delayed in the child with the who is suffering from or who are mentally retarded. Okay, who are mentally retarded. Okay, so that is usually about this intellectual functioning. So next is adaptive behavior. Okay, so next area where you can see some like some delay or some problem in the mentally retarded children, it is usually adaptive behavior. So this is usually the skills that is required to carry out our day-to-day life. Okay, this is the skills that is required to carry out our day-to-day life, such as to communicate effectively with others, take care of ourselves. Okay, so to communicate with others as well as to take care of ourselves. So this also will be delayed in case or they will not be able to do in the children who are mentally retarded. Okay, who are mentally retarded. So that is usually about this areas where child will be having limitations in the intellectual disability. So that is usually what are the areas. So first is intellectual functioning, that is also known as IQ, that is intellectual quotient or intelligent quotient. So this is the area where the child will be able to reason, will be able to learn, will be able to judge something and solve problems. So this is usually known as cognitive development. So that will be delayed in the children with mental retardation. And next is adaptive behavior. So this is the skills that is required to carry out our day-to-day life. So this also will be delayed, like they will not be able to communicate properly, they will not be able to carry on their day-to-day activities. So that is usually about this areas where they have some limitations, where the children have some limitation in the mental retardation. Children with intellectual disability or mental retardation. So that is usually about this thing. So next is in the general population. Okay, when we take about this general population, about 2 to 3% of children are mentally retarded. Okay, in the general population, about 2 to 3% of children are mentally retarded. Okay, they are mentally retarded. So that is usually there, and about 3/4 of the total cases are mild. Okay, but in this 2 to 3%, about 3/4 of the cases are mild, about 5% cases are moderate or severe. Okay, they will be having severe mental retardation. So that is in general population, when we see about 2 to 3% of the children are affected by this mental retardation. In that, about 3/4 cases are usually mild, whereas 5% children are affected with severe mental retardation. So that is usually, so this can be checked. Okay, how they will assess the mental retardation is that by calculating this intelligent quotient. Okay, they will be calculating the intelligent quotient. So intelligent quotient, it has been classified, it is the formula they have, right, to calculate the intelligent quotient. You would have studied in your first year. That is MQ by CQ, MA by CA into 100. Okay, it is nothing but MA by CA into 100. MA is their actual mental age divided by chronological age into 100. So IQ is usually classified, like it is usually calculated with the help of a formula, that is IQ equals MA by CA into 100. MA is mental age, CA is chronological age into 100. So that is usually done. So the average is 100. Okay, the IQ of the average individual or average children, it is 100, with the majority of people scoring between 85 to 115. Okay, with the majority of the children, majority of the people scoring between 85 to 115. Okay, 85 to 115. So therefore, when the intellectual is below 70, okay, if the intellectual is below 70, okay, if the intellectual abilities or IQ, if it is below 70, then we tell that the child is mentally retarded. Okay, then we can tell that the child is mentally retarded. So that is usually, if they are less than 70, then we can tell that the child is mentally retarded. So when a survey was conducted in a population, about 2/3% of the children are affected by this mental retardation, and in the 3/4 of the total cases are mild cases, and 5% are about more severe cases. And it has been usually calculated by using a formula, that is by calculating this IQ. Okay, by checking this IQ. So IQ, it is calculated, like it has been calculated with the formula MA by CA into 100. A normal average person, it is 100. The normal score of an average person, it is 100. And normally the person will score between 85 to 115. And then if the score is below 70, okay, if the score is below 70, then we can tell that the child is mentally retarded. So that is usually about this thing. So next is etiology. So when we talk about this causes for this mental retardation, the first cause for this, it is genetic conditions. So the first cause for this, it is genetic conditions. So this includes, like, the child is suffering from Down syndrome or Klinefelter syndrome. Okay, if they are suffering from Down syndrome or Klinefelter syndrome, so that time we can say that they might develop this type of children might have this mental retardation. This all are chromosomal abnormalities. Okay, these are usually chromosomal abnormalities. So that is usually, in that case, usually they have developed this mental retardation in the children who are suffering from Down syndrome as well as Klinefelter syndrome. So next is problems during pregnancy. The next cause, it is problems during pregnancy. So that is usually what happens. There are certain conditions will affect the brain of the fetus development. Okay, they affect the fetus brain development. So that mainly includes, like, if the mother is having like if during pregnancy, if she consumes much of alcohol and drug. Okay, if she consumes alcohol and drug, smoking, if she continues smokes, or if the mother is malnourished, that is usually done. And in certain cases, if she takes certain tetragonic drugs. Okay, if she takes tetragonic drugs during pregnancy, that time also usually happens, or exposure to such tetragonic poisons or drugs, that they will usually be addicted, like it usually affects the fetus brain development. Then placental insufficiency in case of pre-eclampsia, as well as antepartum hemorrhage. So these are the conditions where it usually affects the fetus brain development. Okay, it usually affects the fetus brain development. That is problem during pregnancy. That is usually, it includes mainly where it affects the fetus brain development. It usually affects the fetus brain development, like if she if she consumes alcohol, drugs, or smoking, or if she is malnourished, if there is antepartum hemorrhage, pre-eclampsia, as well as placental insufficiency, or she is continuous exposure to tetragonic poison, that time also this usually can occur, that they might have this, like it affects the brain development. Okay, it usually affects the brain development. So first is genetic conditions due to chromosomal disorders. So next is due to any conditions during pregnancy. Then problems during childbirth. Okay, problems during childbirth. So this usually occurs where during childbirth also, when the child is deprived of oxygen supply. Okay, when the child is deprived of oxygen supply, especially in case of premature delivery. Okay, especially in case of premature delivery or low birth weight babies, okay, premature delivery or low birth weight babies, or if the baby is having intracranial hemorrhage, okay, or the baby if they are having intracranial hemorrhage, so that time also usually they can develop this mental retardation. So that is problems during childbirth. So that is usually occurs when there is like during childbirth, if there is oxygen supply is reduced, okay, if the oxygen supply is reduced, like asphyxia if the baby is having, like in case of premature birth delivery, or in case of low birth weight babies, or in case of intracranial hemorrhage, okay, in case of intracranial hemorrhage. So next is in case of postnatal conditions, okay, in case of postnatal conditions, that is after the delivery, okay, after the delivery, if there is any head injury, or if there is any like infection to the CNS, okay, central nervous system, okay, if there is infection to central nervous system, hypothyroidism or iodine deficiency, okay, iodine deficiency, encephalitis, or there is lack of breastfeeding in case of if the mother dies immediately after the delivery, okay, if the mother dies immediately after the delivery, so that time, in that case, this usually happens that they might develop this mental retardation, meningitis or hydrocephalus. So that is usually about this postnatal conditions that usually causes is mental retardation. So it mainly includes infection to CNS, encephalitis, meningitis, hydrocephalus, lack of breastfeeding, that is after mother dies after the delivery. So that is there. And next, in case of congenital conditions, again, in case of congenital conditions like microcephaly or cranial malformation, or so this is usually leads this mental retardation. So in case of congenital anomalies like microcephaly or any congenital disorders can lead to this mental retardation. So that is usually about this. Other than that, it can be due to cultural factors or environmental factors if the child is not being cared properly, like child neglect, okay, if they go with child neglect, child abuse, broken family, okay, if the child is born in a broken family, so in that case usually it might lead to mental retardation. In that case it can lead to mental retardation. So that is usually about this causes of this mental retardation. So that is mainly includes it can be like genetic conditions or conditions during antenatal period, problems during pregnancy or problems during childbirth, postnatal conditions, in congenital disorders, and in case of environmental and social factors. So clinical symptoms. What are the symptoms that we can develop in case of mental retardation is that it is usually different for different children. Okay, it is usually different for different children. Like in case of infancy, during infancy, like they will not be able to feed, they will be having pure feeding, weak coordination, or they will not be able to suck properly. Okay, so that is poor feeding will be there, they will be having weak coordination, they will not be able to suck properly. Weight gain will not be there, and the developmental will be delayed. Okay, so development stages will be delayed, so they will be having delayed to reach the milestones. Okay, they will be able to reach the milestones. So that is usually seen in case of infancy, whereas in case of children, speech and language disability will be there. So there will be delay in the speech and language development. Okay, there will be delay in the speech and language development. Milestones remaining like walking, standing, running. So all that thing will be delayed. Okay, that type of milestone also will be delayed in the children. They will not be able to achieve independence. Okay, so they will not be able to achieve independence, like the activities which they do. Okay, the activities which they do, they will not be able to perform by themselves. Okay, they will not be able to perform by themselves. They will not be able to. They will fail to go for like toilet training. Okay, they will fail to achieve this toilet training. So that is usually there. Next is usually what happen. Sleeping problem will be there. They will not be able to sleep properly. So they will be having difficulty in solving the problem as well as thinking. Okay, they will be having difficulty to solve the problem as well as thinking. Okay, so that is usually about this symptoms that is usually seen in case of children, in toddlers. Okay, in case of toddlers. So that is in infants, poor feeding, that is they will not be having weak coordination will be there, they will not be able to suck properly, and the milestones that they have to achieve, so that also they will not be able to achieve properly. So that is usually there, and also they will be like head control will not be achieved. Okay, head control will not be achieved. Whereas in case of toddler, they will be having like milestones they will not be able to achieve, that is running, walking, jumping, so that they will not be able to achieve. Toilet training they will not be able to achieve, as well as they will having like speech development will be delayed, and then they will be like sleep problem will be there, and also they will be having logical thinking problem will be there. So that is usually in case of toddler. Whereas in case of children, so that is usually what happened. They will be having severe intellectual disability like along with other diseases. Okay, they will be having severe intellectual disability along with other disorders like autism will be there, skill impairment will be there, motor skill impairment will be there, autism will be there, motor skill impairment will be there, vision and hearing problem will be there. Okay, vision and hearing problem will be there. So that is usually the symptoms that is usually seen in case of children. That is mainly they will be associated with other disorders. So these are usually the symptoms that is seen in the infants, children as well as toddlers. So infants, I have told you, they will be having they will be having poor feeding. Okay, they will be having poor feeding. Then they will be usually coordination will be there. Coordination will not be there for sucking and all. Then they will be having they will be having poor feeding ability. Head will not be controlled. Milestones will not be able to achieve. That is usually there. In toddler, you can see in toddler usually they will be having they will not be able to achieve the milestones that they have to achieve. So all these milestones they will not be able to achieve. Then they will be having difficulty to language and speech development will be delayed, or problem in thinking and reasoning usually will be there. So that is usually about in the toddler, whereas in children it will be associated with the other disorders like autism, everything will be included. So what are the diagnostic evaluation that we have to do in order to do this? So mainly we have to go with history. It should be collected from the antenatal period, intranatal as well as postnatal period. So all the history regarding antenatal, postnatal and intranatal should be collected. Family history should be detailedly collected. Birth history should be collected. Then history of any past illness. Okay, the history of any past illness should be collected. And so there is complete history should be collected. Okay, complete history should be collected. Birth history, past history, antenatal history, everything should be completely collected. Then we have to go with physical and neurological examination should be done. And then IQ test has to be done. Okay, so IQ test has to be done. So that is done. Then we have to detect for any congenital malformation. Okay, if the baby is suffering from any congenital malformation, so that has to be checked. So that is usually there. And the other investigation that we go, it is mainly urine test should be done for any, to check out the presence of any metabolic disorders. Okay, urine test has to be done to check out if there is any metabolic disorders. So that is then we have to go with chromosomal study. So that is usually because I have told you that it might be this mental retardation will be linked with Down syndrome. So therefore the chromosomal study has to be done. Okay, the chromosomal study has to be done. Then CSF study should be done. Okay, if there is an infection, because infection also leads to this like meningitis, encephalitis. So therefore CSF study has also be to be done. Okay, CSF study should also be done. Then X-ray, CT scan, MRI scan, all the scans should be done. So that is usually about this diagnostic test that we have to do in order to confirm with mental retardation. That is history should be collected, physical examination, neurological examination, urine test has to be done, then IQ test should be done. Then we have to go with chromosomal study, CSF study should be done. Then we have to go with X-ray, CT scan and MRI scan. So next is management. So management, mainly we go with preventive management only will be done in this to improve the intellectual disability or to identify this intellectual disability. So in that first is pre-marriage counseling has to be done. Okay, pre-marriage counseling has to be done to the couples. So that is mainly pre-marriage counseling should be done. Then consanguineous marriages should be avoided. So that is usually done. Then we have to avoid early marriage. Okay, we have to avoid early marriage, that is before 18 years in girls. Okay, especially before 18 years in the girls, as well as late marriage should also be avoided, that is after 35 years. So that is pre-marriage counseling should be given to the should be given. Consanguineous marriages should be avoided. Then we have to avoid early marriage and late marriages should be avoided. Then we have to provide a healthy environment to the child. Okay, we have to provide a healthy environment for the child, healthy environment should be provided to the child. So in the family they should have an healthy environment. Then antenatal, postnatal and intranatal services should be provided properly to the mother during her pregnancy. So that is usually there, so that healthy so that we can have a healthy child. So that is usually done. Then genetic counseling should be given. Genetic counseling, it is mainly given to prevent chromosomal abnormalities. Okay, genetic counseling, it is done mainly to prevent chromosomal abnormalities. So that is usually there. Then newborn care should be done. Okay, so newborn care should be essential newborn care should also be given. So that is usually then in case of if there is low birth weight babies. Okay, if there is low birth weight babies, then preventive management, preventive measures should be taken. Preventive measures should be taken so that low birth weight babies can be improved, as well as the preterm babies. Okay, as well as the preterm babies. So that is usually then malnutrition, if we have to prevent this protein energy malnutrition. Okay, we have to prevent this protein energy malnutrition, iodine deficiency during infancy. Okay, during infancy, therefore proper breastfeeding should be given. Okay, so that proper breastfeeding should be compulsory given. We have to health educate the mothers that proper breastfeeding should be given to the children, so that we can prevent this PEM as well as iodine deficiency can be prevented. Then birth infections should be prevented in the neonates. So with like hygienic practices, we have to follow hygienic practice. Hygienic measures should be followed so that we can prevent infection in the neonates. Next is that immunization should be covered. Okay, 100% immunization should be given for the kids so that we can prevent all infectious diseases. So that is just like mumps, measles, tuberculosis, diphtheria. So all this can be prevented. So therefore, like immunization should be done. That is usually about the management. So mainly we go with preventive management in case of mental retardation, like pre-marriage counseling. Consanguineous marriage should be avoided. Then we have to avoid early marriage and late marriage. Then proper care should be provided to the mothers during antenatal, intranatal as well as postnatal. Essential newborn care should be given. Like proper like we have to health educate the mother to go with breastfeeding so that we can avoid like PEM as well as iodine deficiency. Genetic counseling it should be given so that we can avoid chromosomal abnormalities. And then we have to go with birth infections should be prevented. Immunization should be given for the kids so that we can prevent all the infectious diseases. Then proper neonatal assessment should be done. So this is usually about this mental retardation. So mental retardation, it is also called as intellectual disability, where they will be having delay in the developmental period. So they will be having low average general intellectual function as well as lack of doing necessary skills that is needed to carry on their day-to-day activities.